Magda Rosinska, estudiante de doctorado en la Universidad Autónoma de Barcelona, con el título preliminar Response to Eating Disorder Treatment and Personality Profiles, programa de doble titulación Psicología y Neurociencias por la Universitat College London, Pierre and Marie Curie University, licenciada en Psicología y Neurociencias por la Universidad de Connecticut. Ha sido agente de soporte de servicio al cliente en Web Help Group, Google Partner Program Support, asistente de investigación en el Instituto Nacional de la Salud y de la Investigación Médica en París, Francia, profesora de inglés. Dentro de sus publicaciones podemos mencionar The Early Cognitive Development of Children at High Risk of Developing an Eating Disorder, además de Comparing the Personality Traits of Patients with an Eating Disorder versus a Dual Diagnosis. Primer lugar con la ponencia en la modalidad oral, Personality Traits of Patients with an Eating Disorder, compared to patients with a dual diagnosis using the Temperament and Character Inventory Revise, en el cuarto Congreso Internacional de Investigación en Ciencias de la Salud en 2019 en Tabasco, México. Magda Rosinska, creativa, organizada y pragmática.
My name is Magda Rosinska and I am a PhD candidate at the Autonomous University of Barcelona. And for my PhD, I'm doing research regarding personality traits and eating disorders. I'm doing this research in a clinic which is called ITA, and they specialize in eating disorders. So the first thing that I'm going to discuss is personality traits. What are they? They are your daily thoughts, patterns, and behaviors. They're relatively stable over time, although your reactions can change. For example, if you have perfectionism and it's impeding completing or beginning tasks, then you can change the reaction you have to the thought. For example, if you need to, let's say, write a paper and it's due tomorrow, and you're like, no, I'm going to write the paper only when I have all of the information and I know exactly what I'm going to say. Rather than, oh, I have a paper due tomorrow. Okay, let's get to writing and see what comes out and I can edit it later. That you still have the trait, but the reaction you have to the trait is different. And what are eating disorders? Eating disorders are mental illnesses where there is a distorted relationship with food. And these mental illnesses have various physical symptoms having to do with the heart, the digestive system, etc. For example, with the heart, with someone who has an eating disorder, they may have bradycardia, which is when your heart slows down, the beating of the heart slows down, and the resting heart rate is very low. Also, with the digestive system, in the intestinal tract, the nutrients could not be absorbed by the body as well either. Also related to eating disorders is how the person sees their body, weight, and food. And this all has to do with the control they have over these topics. Some eating disorders are anorexia nervosa, bulimia nervosa, binge eating disorder, and other specified feeding and eating disorders. These are only a few. There are many more that exist. So my research is comparing the personality traits of patients with an eating disorder versus a dual diagnosis. And I'll get into what a dual diagnosis is later on. So first of all, there are patients with eating disorders. And so my sample was a clinical sample based in this clinic, ITA. And the core thoughts and behaviors that are associated with people who have eating disorders are overvaluing eating, overvaluing shape. So these are the common things that are seen in people who have an eating disorder. Associated with anorexia nervosa is usually perfectionism, and it has been identified as a stable trait, which means that it doesn't happen because of the anorexia, it precedes the anorexia nervosa. So therefore perfectionism is already there before the mental illness begins. And whereas for bulimia nervosa and binge eating disorder, it is more common that the person is more impulsive. but these traits can be either or as well. Some major comorbidities that occur with eating disorders are anxiety, depression, and impulsiveness. Therefore, the patient could have an eating disorder as well as anxiety, eating disorder as well as depression, any sort of mix. And what is a dual diagnosis? Dual diagnosis is someone who is a diagnosis for someone who has a mental illness, in this case, an eating disorder, as well as an addictive illness. So in this case, it would be an addiction to drugs or alcohol. Now, why did we look at people who are addicted to drugs or alcohol? It's because there is a high prevalence of substance use disorders. Substance use disorders are defined as an addiction to drugs or alcohol in this study. And there's a high prevalence of this in patients with eating disorders. And it can range from 22 to 50%. So you could see potentially half of the patients with an eating disorder also have a substance use disorder. Now, in my study, I used a personality inventory, which is called the Temperament and Character Inventory Revised. And this is by Robert Cloninger. And there are two parts to it. There's the temperament part and the character part. And each part has scales associated with it. In this inventory, there are 7 scales. The first part, temperament, means that they are biologically based elements. They're moderately heritable, apparent early in life, and moderately stable across settings. In this case, associated with temperament is novelty seeking, harm avoidance, persistence, reward dependence. Whereas character is defined as the reflection of the development of the individual through experiences. So how they interact with other people throughout life. And these scales are self-transcendence, self-directedness, and cooperativeness. Now, each of these scales also have subscales, but we won't go into that now. But just for your general knowledge, it's a very vast inventory. And in this study, we found that the eating disorder group had higher scores compared to the dual diagnosis group. They had higher scores in harm avoidance and cooperativeness, whereas the dual diagnosis group had higher scores in novelty seeking. Now, these were the traits that differed the most between the two groups, novelty seeking, harm avoidance, and cooperativeness. And this was interesting to note because we could clearly see differences between the two groups. And this could help us in the future. So why did I do this research? It is to improve the clinical treatment, which is related to their personality profile. Therefore, if a patient comes into a clinic and they are assessed on their personality profile, there could be a certain type of therapy that could be created to help them for this type of personality profile. It provides a greater understanding of the individual holistically, and the main differences that were found between these two groups may allow for potential new avenues of treatment. So if you have any questions, you can let me know by sending me an email. My email address is magdajulia.rosinska@uab.cat. So I'll spell it out. magdajulia.rosinska@uab.cat. And thank you for listening, and I hope you have a great day.